Hey, I'm Liamith,
My name is Jay, and welcome back to the Medical Frontier podcast.
where we talk about today's inventions, which are tomorrow's standard of care.
In this episode, we're going to be talking about a new medical device, not a prescription, that is useful in helping patients that are bariatric in weight management and also weight loss. So first, we have some statistics on obesity and overweight demographics in the United States. Liamith, would you like to start us off?
Yeah, so when we're looking at obesity and overweightness, it's kind of an increasing issue, especially with the foods and all the processed foods. Especially fast food has been a huge cause of the obesity. I would almost say that it's an epidemic. And obesity has even said to have more negative effects than smoking, according to an Orlando clinic. And some effects of obesity can result in cardiovascular disease, type 2 diabetes, things that are irreversible. And nearly 1 in 3 people in the United States were overweight in 2017 to 2018. And more than 2 out of
Wow.
5 people have obesity. So it's not only just a small amount of people, it's a wide amount of people that are getting affected by this, and it's a very serious thing that isn't being taken as seriously as it should. And even regarding gut health, the foods that cause obesity that are being consumed are also not good for you. And your gut is basically your second brain, and it impacts your everyday life. It impacts how you are, how you sleep, how you act, how you feel. And obesity is just another issue that we need to worry about in the healthcare realm that I think is very overlooked. And it's not seen as a healthcare issue when in reality it is, and it's much more than just that.
Yeah, I really like how you said that your gut was basically your second brain because I also really do think it is just that because like you said, the food you put in your body is what determines how you act, how your mood throughout the day, how you function and whatnot. And so the foods that we're putting in ourselves right now, or that's making more of a rise in not only the United States but the world, is processed foods and fast foods, like you were saying. So, so greasy foods and overly processed foods. What they do is that in your cardiovascular system, they cause high buildups of plaque, which can reduce blood flow. It's also why like most heart attacks and uh, attentions and things like that are caused by
Yeah.
buildups of plaque.
Yeah, and when talking about arterial plaque buildups, the amount of bypass heart surgeries that need to be conducted on many individuals because of this. And arterial plaque buildup is not something that's reversible. If at the age of 20 you eat fast food for a whole year and there's plaque that builds up in your arteries, there's very, very little ways to. You can't turn that back unless you get surgery. And
Yeah.
surgery is not an easy thing to go by. It's a very serious, very dangerous surgery. And
Mhm.
it's just better to focus on putting good food into your system in order to prevent this and all the other factors that come with being obese.
Right. Yeah, the surgeries, they're definitely going to be invasive surgeries to deal with situations like this. What they would have to do is go put in a stent into your system. So the stent is going to go in, it has like a little balloon inside it. So using an endoscope and some air, they're going to blow up that balloon that's inside the stent. And that causes the walls of the stent to expand, which also, since they're resting on your coronary artery, it's going to expand that so blood can flow through and bypass that plaque buildup. So just a couple more
Mm-hmm.
statistics that I have. So in 2016, overweight and obese people actually outnumbered the thin people. And by no means with that are we claiming that um, being thin or being skinny is the right way to be. We're not claiming that. It's just with 8 billion people in the world, it's everyone is different. We acknowledge that. It's just an interesting dynamic that we've never seen before with the population that we have right now. And by 2035, if trends don't change with the way we're eating and our habits of being more sedentary than normal, more than half or more than 50% of the global population will be obese or overweight. And that's just in 2035, which is a mere decade away.
Yeah, I think that's a huge, huge thing that we need to be aware of, and it's something that we really need to take action on soon. Because a decade is really not that long of a time. I mean, 2014 was just literally, it felt like last year. So in regards to fighting obesity and combating obesity, there was a not a drug, but as Jay called it, a mechanical device that was implemented and FDA approved, and it's a pill, it's a capsule. It's called Plenity, and basically what this does is people take this drug with water, and 20 to 30 minutes before eating, and so. If you want to explain a little bit more, Jay, about
Sure.
what it actually does in the stomach and how it takes up space.
Yeah, so basically, like Layman was saying, people before they eat, 20 to 30 minutes before consuming food, they take the capsule with water, which is a device, and when taking it water after it's ingested in your stomach, once it reaches your stomach, the super absorbent hydrogel particles that are inside that capsule will actually mix with the water, and they increase in size up to 100 times what they were inside the capsule. So when that happens, it takes up about 25% of the space that's inside your stomach currently. And if you take away 25% of the space inside your stomach, you can see that you only have 75% capacity in your stomach left to actually intake food. So that's kind of a way, just a basic explanation on how it works. And there's no side effects that are directly to the body, because it's like we're saying over and over again. It's not a drug, since it's not taken into your blood. It's not impacting any of the hormones or enzymes or anything like that. So once it's ingested, after it goes into your large intestine after eating, it loses its absorbency, and it loses its properties like that, and it just leaves the digestive system just like everything else would, basically.
Yeah, so again, the device has been to be pretty effective with very minimal side effects. Overall, on a review system, they all have 3.7 stars, which is pretty solid, especially when we're talking about the healthcare field and about how various people's human bodies work and how some things may not work for other people. It's been mainly positive. Some one person in particular said, Plenty helped me to feel full at mealtime. I have tried so many other ways to lose weight and finally found one that is actually working. I am now able to eat less due to Plenty. I'm actually making progress towards my weight loss goal and am ecstatic. Also, Plenty gives me daily reminders to take my pills so I won't forget, which is very helpful. Wonderful product. So, as we're seeing here, this person in particular has tried other ways to lose weight and obviously knows the awareness of what can come with being overweight or being obese, and they were able to make a change in their life due to this medical device. And obviously it's still pretty new. 5 years is not a long time to be on the market and to have really put into clinical trials is for the long-term effects of it, right? So if it takes up space in your stomach, what does this do long-term down the line? Because again, when you're interfering with the human body's processes in any way, shape, or form, if it's affected, there are going to be some sort of effects long-term, because that's not supposed to happen. You're not supposed to take a pill and it's not supposed to like fill you up, right? And at the end of the day, for right now, yeah, it's doing fine and it is being removed from the body completely fine and okay. But in a long-term scheme of things, maybe these people are having a loss of appetite when they continue to lose weight, and maybe the weight loss doesn't stop, right? Maybe this increases their appetite if they stop taking the pill and they have withdrawals from it. And I mean, you don't know, right? So I think that's one thing. So Jay, do you know if any doctors have recommended this or have pointed people into the direction of that, or anything about the long-term effects? Has there been anything done on it?
Right. Yeah. So before actually filming this, like when we were doing our research, I saw a doctor from Weill Cornell Medicine. What he was saying is that Plenty actually has a dual effect. So not only does it give you that feeling of being full to make you eat less, it also has a slower calorie absorption rate. So if it has a slower calorie absorption rate, since the amount of calories that you already intook, those are taking more time to be absorbed into your system. It's another way for your body to, regulate how much you eat. Since if everything you've already intaken has not been processed yet, then your body, it tells you that, right now there's not really much need for more food to be intaken, since we're already not done with what we have right now. So to finish that task first. So that's something really interesting I found about the dual effect of plenty.
That's great. That's awesome.
Overall, in with like the trials that they've done, I think it was about 6% reduction in body fat that we've seen with that, and even up to 10% in some cases that we've seen when using Plenity. So overall, a really really effective way for people looking into weight management. And I'd like to point out that also there's a big difference between weight loss and weight management. So when it comes to weight loss, you have your more invasive techniques that you need surgery for, like insertion of a gastric band, which they go in with an endoscope to monitor what's going on inside. They put a band around like the entrance of your stomach, and so it manually reduces the amount of food that can go in, so you intake less. There's also gastric balloons, which kind of works similar to Plenity, but basically it's a balloon that's filled up with water, and it takes significant amount of space inside your stomach. And there's also endoscopic suturing, which is another invasive technique where they actually go in and suture like a portion of your stomach so that food physically cannot pass through that point. So it's literally making your stomach smaller. That's one way. And then when we have weight management, we have things like a ingested gel, which is exactly what Plenity is, and there's also an oral palatal space occupier. So what that does is basically it's a space occupier. So we can kind of tell that when you're eating, it takes up space in your oral cavity and your oral palate, so you can't actually intake as much food as you normally would, which is another way to limit the amount of food that you're intaking.
Yeah, that's cool. I think from the things that you were describing, a lot of it was oral based, in order to kind of that mind game that you're playing there. Another question is, I know that a lot of people know about this, but the body mass index, right?
Mm.
And the levels as to what is described as underweight, what is described as overweight, what is described as obese, right? So we have two different categories here that we're technically targeting with this device, would be the overweight and the obese group. So is the drug, or is the device, sorry, to be so effective that only obese people can take it with a body mass index of 30? Or is it also safe to take if I'm barely above the normal range and I'm sitting at like 25 or maybe 24.7, but I'm still not happy with the way that I am and I'm trying to lose weight?
Yeah, so based on what the FDA and doctors have said about this, you actually don't only have to be in the obese demographic to be able to use this. You can also actually be in the overweight class. Liamith, do you have like the exact BMI numbers or like the range that you can take?
Yeah, I'm pretty sure from what I saw on the research, on the PubMed article that was published, it did say that it was 25 or more,
Mhm.
so that is the exact um, group for being overweight. The bare minimum bar is 25, and so if you're anything above 25, which is basically just anybody who's listed as overweight, they're clear to take the drug. And obviously it would be better if you would prefer not to go with that route if it's something that you're on the border, but it is safe to take if you're in that overweight range.
Right. And another point that a lot of professionals have pointed out is that not only would you be taking this prescription, it's also very important to maintain or cut back on those lifestyles or habits that might be contributing to not being the weight that you desire. And I think it's really important because not only is it that the medical advances are helping you, you actually also have to take care of yourself along with that. So the types of food you're eating, like we mentioned in the beginning, the sedentary lifestyle. I know that's a really big one,
Mm-hmm.
especially like with the types of works, with the types of careers that we have right now. Like having a sedentary lifestyle is a really really big contributor to people, actually obesity rates doubling since the 1990s, and I feel like that sedentary lifestyle is a big part to do with that.
Yeah, I completely agree. I mean, this in particular, if we're talking about the lifestyle changes that have been implemented in people and with the use of technology, right? I could sit in my house and be able to work remotely. I could, I could go in my car, which goes 80 miles an hour, opposed to previously maybe walking short distances, right? And beyond just that, I think from what a young age, especially, that the things that happen into the sedentary lifestyle are due to habits that are created at a young age. And especially with the youth now and the technology revolution of constantly VR and all these different things and video games and all of that, that people are really putting that active lifestyle in the back seat, and why we've seen initiatives from organizations such as the NFL with NFL Play 60, encouraging kids to exercise 60 minutes a day, because when you create that habit, it prevents things like this from occurring. And especially even for adults, right? We're starting to see kind of a decline in athletic activity in the 20s to 30s range, right? There's usually people who end up coming back into playing like pickleball or some other things, and when they do that, then they come back and they get re-injured because their muscles aren't strong enough because they haven't been strength training the rest of their life. So that's another topic. But
Right.
if you create this habit and you create this cycle of activity and exercise, whether it be through strength training, right, or exercise, cardiovascular, any of those things, particularly in this scenario, obviously cardiovascular exercise would be more preferred. But once again, I think it's that habit that's being created from a young age, and now we're seeing all these kids who are growing up who have had access to technology at such young ages that they weren't required to go outside. Like if I wanted to go play with my friends, I would just play on the video game now instead of going outside and playing basketball. And I think that's something that I think as in as part of our generation that we need to teach our kids, and millennials need to teach their kids to push away from that, because we're seeing the negative effects of that. And there's just so many new things in technology that are coming out that are just negatively impacting the lifestyle,
Right.
not just with this sedentary lifestyle, but with vaping and all these new devices that are coming out and stuff like that. Like
Yep.
that's something that it's technology being developed, but not in a good way.
Hmm.
And people are just losing themselves, and there's just so much going on with the healthcare industry that are that stem from a lifestyle perspective.
Right.
It's not genetic conditions, it's not pre-existing conditions, it's what you do with your time that affects your body, and it affects your mental health and whatnot.
With that being said, it's just something that I've heard many times over and over again, which I believe is really important. Prevention truly is the best medicine, like
Mm.
we've been emphasizing. If you can prevent everything from happening, you really have no reason to seek for a treatment to it. If you can prevent what's happening, you'd be living life how you want to all along. There's no reason for you to go out of your way to try to search for somebody to help you. Maybe only if it's a dire need, but if there's a way you can prevent it, go after it. That's what I would say is the biggest takeaway from this episode, and the research we've done on
Mhm.
obesity, being overweight, and whatnot.
Yeah, I completely agree. I think even as we're kids and as we're growing up, an apple a day keeps the doctor away. That's the
That's a big
the
one.
the simple preventative medicine that we were taught as children. And I think that over the years it's kind of drifted away from that, and we're focused on these treatments and these cures and this new scientist who found this drug and that drug. But this episode in particularly like is the best explanation for with no pre-existing conditions. Obviously people are, they're different. People are going to be at more risk to gain weight easier, or high metabolism, low metabolism, but at the end of the day, this in particular can be prevented. And that's something that we really want to encourage you guys to do, is to go out, exercise, you know, do something, be active for one day out of the 7 days in a week. It doesn't have to be every day. I mean, people are busy. That's the other thing, right?
Hmm.
People get busy, and that's what causes that sedentary lifestyle, as you said. So,
Exactly.
yeah.
Yep. And with that being said, guys, this was a very informative episode for us. Hopefully, it was also very informative and engaging for you all to listen to. And if there's any more topics that you'd like to see specifically, drop those down in the comments below, and we'd love to see what ideas you have to suggest for us. And yeah, I really enjoyed doing this.
Yeah, thank you guys. We will see you guys next time.
Thank you, guys.